This is Dr. Adam Goldstein. I am a professor of family medicine at the University of North Carolina in Chapel Hill, and I'm the medical director of the Town of Chapel Hill's Works-Cited Wellness Program. We hope this short video will be helpful to better understand the rationale behind vaccination for COVID-19 and the potential myths, misperceptions, and the benefits, and also how you might be able to better get your COVID-19 vaccination. We know that over the last year, we've seen ups and downs of COVID-19. And a year ago, as things were rapidly escalating, who could have predicted how bad it would have gotten? And who could have also predicted that since 2 months ago, when things were really at its height, that things have gotten so much better, in large part because of COVID vaccinations that are now available and increasingly being made available to people around the state and around the nation. There are currently 3 authorized vaccinations: the Pfizer and Moderna vaccinations that are available to those ages 16 and 18 and above, respectively. There are 2 doses 3 weeks apart for the Pfizer and 2 doses 4 weeks apart for the Moderna. The Pfizer and Moderna are highly effective, 94 to 95%. Janssen by Johnson & Johnson is now available to those 18 and above, and it's 1 dose, and it's also effective at 66%. Well over 2.6 million doses have already been delivered and started vaccinating North Carolinians. And this is such an important because it's really making an impact. And hopefully those who've not yet been able to get their vaccination will see this and understand better why they should do it and how they can go about getting the vaccine. What are the benefits? Well, we know when these first came out that these vaccinations were highly effective at preventing symptomatic COVID-19. So getting COVID-19 and developing any symptoms. If you developed symptoms, they were highly effective, even more so at preventing severe COVID-19. And then even if you developed a severe case, preventing a hospitalization. And then finally, even if you were hospitalized, preventing death. So effective that they were delivered quickly to consumers once it became known how effective they really were. But we since discovered that they also appear very effective at actually preventing COVID infections in the first place, not just symptomatic, but preventing them. And we're still learning more, but also it does appear emerging evidence that they're effective at preventing transmission to others. So along the continuum of all the reasons and all the benefits that one would get from these vaccinations appear to be critically important in reducing, preventing, and helping us conquer this pandemic. Prior receipt of a COVID-19 vaccination will not affect if you do get symptoms and need to get a COVID viral test. What are some of the side effects of these vaccinations? Well, most people will get some local reaction: pain, swelling, redness, maybe not dissimilar to what one would have gotten from other vaccinations that one gets. And 2/3 will get some systemic reaction: fever, fatigue, headache, chills, myalgia, and arthralgia. These symptoms do appear to be mild in most cases and resolve within 1 to 2 days after vaccination. Some are moderate and may last for a few days. It's very unusual to have a severe reaction to these vaccinations. It does appear that the symptoms are more often and maybe a slightly higher amount in those who are younger than older because of immune response, which actually in some respects, getting an immune response suggests that you really are getting protection. If one develops moderate or severe symptoms, one can take acetaminophen for post-vaccination local or systemic symptoms. One shouldn't take the acetaminophen before getting the shot thinking that they would help or reduce, because one wants to make sure one gets the full benefits, and if one doesn't need these medications, one should avoid taking them. What are some of the myths or misperceptions? Well, I've heard from several patients that they think these are live vaccines and I can get COVID from the shot. Well, this is false, because in the reality, None of the current COVID-19 vaccinations are live virus vaccinations. None of them transmit COVID. What about severe allergic reactions occur frequently after getting the shot? This is also false, as the reality is severe allergic reactions are rare after getting the shot. Well, maybe I have an immune condition, such as asthma, and I cannot take the vaccination. This too is false, as the reality is immunocompromised people can receive COVID-19 vaccination, and it will be highly effective with them as well. What about I am pregnant, considering getting pregnant, or breastfeeding, and I cannot take the vaccination? This too is also false, because the reality is any of the currently authorized COVID-19 vaccinations can be administered to pregnant or lactating women. We do not have enough data, and we're still gathering that, but we strongly believe that the side effects of getting COVID are far worse than anything we've seen with the vaccinations. So we strongly encourage those who are pregnant, considering pregnant, or lactating to actually get the vaccination. What about I'm allergic to lots of medicines and I heard I should not get the shot? This too is not true, as the reality allergic reactions related to foods, pets, or oral medications are not a contraindication or precaution to getting a COVID-19 vaccine. I already had COVID and I shouldn't get a COVID vaccination. Well, that is not true, because COVID vaccination for those who already have it can be given safely, and those who've had it will lose their immunity over time, and this will help protect them from getting a future infection, and is strongly recommended after you've recovered from your initial COVID. What if you've had a COVID-19 vaccination, you're exposed to someone with COVID-19? Well, the good news about this is that actually you're not required to quarantine if you were fully vaccinated after the 2 doses of the Moderna or the Pfizer, or after the 1 dose of the Johnson & Johnson vaccination. If it's been 2 weeks since full vaccination, you're still within 3 months of getting your last dose in the series, and you've been asymptomatic, not having any symptoms despite that COVID-19 exposure. I think this is a wonderful CDC recommendation that will really help people get back to the lifestyle that they want to be able to achieve. Who can get vaccination? Most recently, as of March 9th, we've been vaccinating Group 1, Group 2, and now Group 3, the healthcare workers on the front lines, adults greater than 65, those who are other essential workers on front line. And eventually, I think within the next 2 to 3 months, we will be vaccinating Groups 4 and 5, high-risk adults, and then everyone. And this will just be such an amazing time period, and it really will make a difference in protecting and preventing death. This is the UNC Health COVID Vaccine Hub. I'll have its website available at the end of the talk, so you can get information here, such as this, on availability, safety, and the science, a wonderful one-stop shop. There's also a great website that I have at the end, and I have it located here now, from the Department of Health and Human Services in North Carolina, called myspot.nc.gov. And this shows where you can get vaccinated. Most people are getting vaccinated in their county, and that's a wonderful and very appropriate. And one can go online and see where those spots are, whether it's at a health department or maybe within an academic health center at locations, pharmacies, private physicians' offices in other counties. And these can be found by going to this and putting in your zip code or city, and you see what's located. This is one when we just put in within around the Chapel Hill area, and one can go and ask and call in your county or outside of your county if you want to, and find out, are there vaccines available? Because maybe in some counties there are vaccines and not enough people actually to take them right now, and one can get vaccinated. Even after vaccination, though, I think for the rest of this year, we will still be practicing the 3 W's in public areas and in work sites. And that's wearing a mask for protection, having physical distancing, and hand washing. These are the things that have really made a difference in keeping this pandemic at bay. And until we really have enough information about its resolution, we will be still practicing these public health measures. For more information, the State Health Department, there's a COVID-19 line for general COVID issues. for vaccinations and try to get help with those. There's a number there, and then the MySpot vaccination site. For UNC Healthcare, there's a COVID vaccination line for any UNC Healthcare sites across the state, and the vaccine information that I posted earlier. This is the website. Remember, whether you are given 1 shot or 2 shot, all COVID vaccinations help prevent COVID-19. They're effective in preventing hospitalization and death and will offer protections. The current vaccines are also safe. They've been tested, they're effective, and they're essential to helping us get back in control in our lives, really protecting those people that we love and being able to resume the sorts of activities and jobs that we treasure and value and are necessary. On behalf of UNC Healthcare and the Worksite at Wellness program for the town of Chapel Hill, this is Dr. Adam Goldstein, and thank you for listening, and stay safe, and I hope you get your COVID vaccination soon.